Female infertility. So, primary infertility is said to occur when a couple has never achieved a pregnancy despite at least 1 year of uninterrupted and adequate unprotected sexual intercourse. So, secondary infertility implies that there has been a previous pregnancy. It is often necessary to evaluate both partners simultaneously to elicit sexual, menstrual, and obstetric history, a past history of pelvic inflammatory disease and sexually transmitted infections, contraceptive use, and other significant past medical histories. The causes for female factors: ovulation failure, polycystic ovarian syndrome, hyperprolactinemia, pelvic factors, congenital malformations of uterus, tubal disease, pelvic adhesions, uterine fibroids, endometriosis, cervical factors. So, male factors include oligospermia, azoospermia, penile and testicular abnormalities, erectile dysfunction. Symptoms are inability to achieve pregnancy despite regular and unprotected sex at least 2 to 3 times weekly, and amenorrhea, as in females, impotence in males. So the signs that are usually elicited in females are absence of secondary sexual characteristics, virilization changes like hirsutism, clitoromegaly, deepening of voice, among others, and also galactorrhea, abdominal masses due to uterine or ovarian enlargements, abnormal vaginal discharge indicative of infection. For males, the signs that are usually elicited are abnormal penile discharge indicative of infection, absence of secondary sexual characteristics, testicular abnormalities, for example, varicocele, small or absent testes, and the investigations: FBC cycling, high vaginal swab, blood glucose, hysterosalpingogram, as best done under fluoroscopic guidance, also semen analysis, serum progesterone level in mid luteal phase, that's day 21 to 23 of menstrual cycle, to check for ovulation, also thyroid function tests, and further hormonal studies, for example, serum LH, FSH, serum testosterone, prolactin, to be done by specialists. The main treatment objectives are to treat the underlying cause of the infertility if possible, to achieve pregnancy within the shortest possible time. Non-pharmacological treatments, counseling, uterine, tubal, and testicular surgery are needed. Assisted reproduction terminologies, for example, artificial insemination, in vitro fertilization with embryo transfer where indicated. So, pharmacological treatments: failure of ovulation, first line treatment, you give clomiphene citrate oral 50 milligrams daily for 5 days, starting between the 2nd and 5th day of menstrual cycle. For hyperprolactinemia, first line treatment, you give bromocriptine oral 1.25 milligram NOT for 7 days with the evening meal or at bedtime. You increase weekly to a maximum of 2.5 milligrams 8 hourly. So, referral criteria: you refer early referral of all patients with infertility to a specialist is preferred, particularly women with uterine, ovarian, or tubal disease requiring surgery, or who require ovulation induction, not responsive to clomiphene citrate. Also, refer male partners for review by a urologist.